Bismillah ar-Rahman ar-Rahim. My dear students, today we'll cover chapter 6, that is literature evaluation to beyond the basics. And this will be our last chapter for this semester. Now, what we are going to talk about in this topic is actually a continuation of controlled clinical trials evaluation. We focused on controlled clinical trial evaluation because it establishes cause and effect relationship, and it measures this effect. But there are other types of evidence that you may use when you want to, for example, develop practice guidelines or provide evidence for a certain treatment or therapy. So let's look at other types of literature. طبعا you will need to talk about or describe or list different types of study designs other than controlled clinical trials that are published. You need to describe number of one trial. It's called number of one trial, and compare it, for example, to a case study. A case study can be on one person, and number of one trial is also done on one person. So what's the difference? Or what are the differences? You need also to describe cohort study, and the opposite of that is called case control study. And another type of design, which is cross-sectional study designs, and you need to talk about the benefits from them and if there are disadvantages as well. You need to describe limitations with regard to case study reports or case series. You need to describe the characteristics of observational trial design. Observational is something that you need to be aware of. Unlike controlled clinical trial, observational, we observe rather than we control or we design the experiment, the treatment, and the control. طيب, describe how we can organize and rank. This is very important, ranking of the trials or studies based on their strength. So which one is the strongest as to provide evidence, which one is the weakest, etc. You need also to describe and define relative risk, which you already took in the previous chapter, controlled clinical trials evaluation, and relate that to cohort study. And on the other hand, you need also to differentiate the relative risk from odds ratio, and odds ratio is applied to case control studies. You need to differentiate and describe the different types of reviews, literature reviews, yani preparing a review article. It can be narrative or non-systematic, we call it. The second one is systematic, and it belongs to qualitative type. في عندنا third one, they call it meta-analysis, but it's also systematic, and we refer to it as quantitative reviews. You need also to list the key questions that you need to ask when you want to evaluate systematic reviews. Also, what are the possible errors and bias when we evaluate meta-analysis? Don't forget, meta-analysis is the systematic review, and it's a quantitative type. Also, you need to discuss the use and evaluation of practice guidelines. You hear a lot about clinical practice guidelines. For example, let's say when we talk about COVID, what are COVID-19, what are the guidelines to treat such patients, or how to deal with them, or the quarantine, how long, what should be done. So we refer to them as practice guidelines, and there are 3 types of practice guidelines that we'll be aware of, inshallah, by the end of this topic. Now, one of the true experiments, it's not observational. When we say true, it means it's not observational, is referred to as number of 1 trials. And why they call it number of 1? The reason why they call it number of 1 is it is applied to an individual patient, and it's carried out on individual patients rather than we have 2 groups. Here we have 1 person, and in this 1 person we still apply randomization. اتذكروا إنه randomization we defined it previously as there is equal chance for the individual to start or to go with drug A, investigational for example, and then drug B, or the opposite. Also, a blinding can be applied because the person and even the investigator may not be aware of the which one is the drug, which one is the placebo, for example. Someone will tell me how it is controlled. It is, there is individual patient. Now remember, when we talked about controlled clinical trials, we were focusing on parallel designs. يعني في عندنا 2 groups. And if you remember, we said the opposite of parallel is what? Crossover. فإذا في individual patient we are doing or we are using crossover design. Crossover design. يعني the same person is taking treatment A. Once it's done, the period is done, there will be a washout period. Washout period يعني some time for the initial treatment or the drug to be eliminated from the body. Then he will start treatment B, which might be placebo. And after the end of that, then the process can be repeated. Maybe he will start again, but not with the drug, but this individual might start with placebo because there is randomization, and then the person might go for the active drug. Okay, it's very useful again when we are talking about individual patient and we want to see whether this individual patient would respond to a certain treatment. As you are aware, some people respond to drug in different ways than other people. Okay, so number of 1 trials would be useful in such cases when the benefit from a treatment is not established for everyone, and you want to establish it for the individual person. It's useful when the drug have short half-life. And remember, short half-life means that the drug elimination will be fast. Yani once I finish the first treatment, I will not have to wait long before I start the second treatment. Okay? And as I told you, it's a crossover design. And it's very useful when we have chronic condition. Okay, chronic condition means it's gonna, or this problem will stay for sometimes. زي في arthritis, pain, when there is pain, chronic pain, etc. So we are looking at symptomatic relief. Okay, number of 1 trial would be very useful in such cases. As I told you, in number of 1, if we are using more than 1 number of 1 study, يعني, for example, let's say I made a literature review and I found that for a certain drug, okay, there has been more than 1 number of 1 trials. يعني I have several investigators have done that for their patients. So I can look at them all, and then from that I can identify the characteristic that differentiate responders, yani those who respond to the treatment and they benefit from it compared to those who do not respond. Yani, again, I will say it again so it becomes clear to you. Let's say I have a drug ergotamine مثلا for migraine, and I found in literature when I did a review, I found there are many number of one trials with this drug, okay, to relieve migraine مثلا. So what I can do, I can look at them all and try to identify maybe female respond better than male individuals. Okay, so I want to see what are the characteristics that can influence those who respond to the treatment and they benefit from it, and those who do not. Again, although we are looking at symptomatic relief, but this can be done through diagnostic test, for example, or in most cases it's symptom and it's measured by visual analog scale. Yani we will ask the patient, for example, from 1 to 10, how do you feel your pain? Okay. Now, how do you judge if the responder benefits from the treatment or not? Let's say Mus'ab, there is a person, Mus'ab, he's my patient, and I give him a treatment, and then I notice that there is rapid improvement when I gave him the treatment. طبعا I'm blinded, Mus'ab is blinded, but I see that when a certain drug or a certain medication or regimen is given to this patient, he improves fast. And then when I give the other, maybe placebo, it's the placebo, I don't know, the improvement regresses quickly. يعني بتراجع, يعني he becomes, or the situation becomes worse طبعا, but not permanently. Okay. But remember the following. One, you cannot just give the drug and there is improvement, then you give the other, maybe placebo, and there is regression in the improvement. No, you cannot just do that. You have to repeat this. Okay, so you start again with, for example, placebo, and there should not be any improvement, and then you give the drug and there is improvement. So all with drug, or let's call it treatment A, there is fast improvement, rapid improvement, and with the other one, which is treatment B, اللي هو placebo, there is no improvement. So at least it should contain, انتبهوا, 2 pairs of treatment periods. Okay, 2 pairs. يعني treatment, no treatment, treatment, no treatment. أو treatment, أو no treatment, 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 no treatment. Okay, so I have 2 pairs of treatment periods. Another thing, that the period should be enough for you to see the effect. Okay, for example, if the pain happens, or if the migraine happens, let's say once every week. Okay, so once every X days, week, and 7 days, then you should cover, or the treatment should cover a period of 3x days, يعني 3 into 7 days, or 3 weeks, in order for you to judge whether there is improvement or not. معناته, if the event occurs every week, then the treatment should be observed for 3 weeks. Okay? This is how you do it. Also, the symptom that you measure should be related to quality of life. Okay? يعني, as I told you, the pain, the migraine, and it should be assessed at least twice during the study period. يعني أعطيته, for example, medication A for 3 weeks, During these 3 weeks, I should at least assess the patient twice. And I talked about 2 pairs of a treatment period before I do unblinding and decide whether this patient or this individual responds to my medication or not. If I want to compare it to a case study, okay, look at the following, because these are very important differences. One, the design of number of 1 trial is prospective. Yani we design it, we control it. That's why we call it true experiment. بينما usually the case study is retrospective. Yani for example, you are talking about the development of skin problems when a patient took a certain drug. So you do not plan this experiment. You do not plan it, you describe it because this is what you saw with the patient. And it's case study because it's not normally presented. Yani this information is not normally presented with the drug, or if you look at the drug labeling, في الليبل تاع drug, they do not say that there is such problems. So you are describing a case that happened with you as a physician, for example, or as a pharmacist. Okay, you say, okay, I gave this treatment as usual, and this treatment is recommended, but this person suffered from so and so, and you try to explain why this might have happened. The number of 1 trial, as I told you, there is a predefined methods. Yani I do the blinding, I do the randomization, everything is predefined for the number of 1 trial. And you know what you are going to measure, and this is very important. You're going to measure, for example, pain, depression, etc. So you know what's your measures. Unlike the case study, it's retrospective, so you do not have such things planned. You just describe what happened. Okay? Randomization blinding is there for number of 1 trial. بينما في case study it's not there. بالcase study it's only 1 person, doesn't have any control, by the way. There is no control. You're just describing an individual case. وفي الcase series بيكون you are describing not individual case, several cases that you might have with your patients. Is there multiple treatment period? Yes, we said in number of 1 trial, at least 2 pairs, شوفوا هون, 2 pairs of treatment period will be there. أما بالcase study, no, it's not usually that. You might, for example, you give a certain treatment and you see a certain adverse effect, and then you change the treatment and this adverse effect disappears. You might have something like that, but otherwise not usually there. Okay, now we will talk about observational design. Okay, كنا نحكي في number of 1 trial, we were talking about true experiment. Okay, there is a design, there is a control. Okay, and it's a crossover design. طيب, بالobservational study, will there be blinding? Will there be randomization? Actually, no. Okay, let's see what is happening. We have an example of observational design اللي هو cohort study. Cohort means group. It means group study. Sometimes they call it longitudinal study. Longitudinal study, because you follow up, or follow-up study. يعني you follow up with the patients that are in the 2 groups. يعني في control, yes. Then you have control here. But it's observational study in the sense you don't determine the treatment that the person should take. You don't do that. You just observe what is available. I'll give you an example. Let's say I want to see if pharmacists will develop. طبعا this is prospective study, okay? You look at the future. Will the pharmacists develop cancer? This is the question, okay? Will pharmacists, will they develop cancer if they work in the preparation of chemotherapy for patients? You know, pharmacists may be involved in preparing chemotherapy. These are materials that are very strong and very destructive, okay? And contamination by these materials can cause cancer. Okay, yes, they are used to treat cancer, but they can cause cancer as well. Especially that the pharmacist will be working with chemotherapy over a long period of time. So I want to see, or I want to answer the following question. Is there a relationship between pharmacists working in preparing chemotherapy and cancer? I want to see that. Okay, so what will you do? You will take two groups, واحد control and the other one is the investigational group, اللي هو the one who's preparing chemotherapy. And then I will start following them up, usually for several years. Okay? أطلع على pharmacists who were exposed to the risk factor, اللي هو preparing chemotherapy, and those who were not exposed, and then I follow them to see what will happen maybe within 10 years or 20 years of their career. And at the end, I will determine for each individual whether there is cancer or there is no cancer. Okay, so this is prospective study. We look in the future, and the outcome is yes, there is a problem, there is the outcome, if he cancer, or there is no such outcome, there is no cancer. Okay, this is cohort study. طبعا it's unethical if you are going to ask to do this as a controlled clinical trial, to ask the pharmacist, some pharmacist, okay, you go and you work in chemotherapy, and ask some other people, okay, you don't work in chemotherapy, I want to see who will develop cancer. It's not ethical to do it like that. You just observe what is there in reality. Okay? طيب, this is diagram representing the cohort study. So you are here, you are taking a sample from the population. طبعا this sample does not have the outcome. Okay, يعني it's clear. يعني ما فيهم cancer. But some of them are working in chemotherapy, يعني exposure positive, الريسك موجود هون. Some of them are not working in chemotherapy, so I will consider them as exposure negative. Okay, and then I will follow them with time, and maybe after 10 years I will see, okay, how many of those pharmacists do not have cancer, how many have cancer, and the same thing here, how many do not have cancer, and how many pharmacists who have cancer. So I will get something like that. Now the opposite of this, opposite cohort study, opposite cohort study, يعني we are here, okay, and we are moving backwards. We call it retrospective. Okay, so we're going backwards. Now the opposite of this one is referred to as case control study. Case control study. أو we call it Torah. Torah يعني شوفوا, it's the opposite of cohort. If you go back here, cohort. So it's exactly the opposite of this one. This is prospective, this is retrospective. Okay? So here we look at the past. طيب, here we start with exposure or risk factor, present or not present. Here we start with outcome positive or outcome negative. So it's exactly the opposite. See, We are here, we look at the population, we took the group with outcome positive and a group with outcome negative, and then retrospectively we investigate their history to see whether they were exposed or not exposed, okay? But at the end we will have the same table, okay? Risk factor, يعني exposed, زي اللي بيحضروا pharmacists to preparing chemotherapy, or the pharmacists who do not prepare chemotherapy. وهنا الاوتكم yes يعني cancer, no يعني there is no cancer, no cancer. طيب, then there are two measures. You remember the relative risk. Relative risk اللي هي the number of positive outcome اللي هو 16 في exposed, those who are exposed 16 divided by the total 16 plus 108 divided by الكنترول اللي هو not exposed 14 صار معهم cancer divided by the total 14 plus 341 and I will get 3.3. في عن طبعا relative risk is only related to cohort study where you look at the future, where you start with there is exposure or there is no exposure. But for Torah study or for case control study, we call it odds ratio. And I will tell you why is it called odds ratio. And it is also calculated similarly but not the same. يعني في هناك difference في الفورمula. Okay? Instead of dividing 16 by the total, no, we divide 16 by 108 divided by 14 divided by 341, not the total. And the reason why they call it odds ratio اللي هي they try to answer the following question. What's the odd? شوفوا, what's the odd of having a cancer and being exposed to the odd of having the cancer and not being exposed? عشان هيك that's why they call it odds ratio. What's the odd of having the cancer and being exposed to the odd of having the cancer but not being exposed? That's why they call it odds ratio, and it's applied to Torah or case study. So odds ratio applies to Torah or case control study, while relative risk is applied to not only controlled clinical trials but also to cohort study or longitudinal study that we talked about. Okay? طيب, let's talk about cross-sectional study, which is again an observational study. But we do it at certain point of time. The cross-sectional study, I want you to think of it is just you are driving in a car. ماشي? You are driving in a car from Ajman, for example, to Abu Dhabi. Okay? طيب, you are driving from Ajman to Abu Dhabi, so there is some time before you reach Abu Dhabi. On the way there will be radars, right? رح يكون في هناك رادارات, and these radars will catch you or will take a photo of you if you are speeding. If you are driving with high speed, it will photo you. Okay, cross-sectional study is just like that. It's just to photocopy at certain point of time. And it's mainly or the main type of study اللي هو survey research. That's why survey research are considered a cross-sectional study. مش crossover, cross-sectional. It tries to assess risk factors and disease development simultaneously, or what is the prevalence of a disease or a condition, or what is the characteristics of a disease. You know how you do the questionnaires or the survey. Okay. طيب, let me just I wanted to go back a little bit to cohort and Torah study. طبعا objective of them is to measure association, مش to establish cause and effects. انتبهوا, this is very important. Okay. إذن الcohort والTorah, both of them, they look at whether there is an association between the exposure and the development of a disease. هل في هناك, and that's what they call it, risk factor. They call it risk factor. They cannot say that this will cause this. لا. They will say that this is a risk factor. Okay. So I want you to differentiate between finding if there is any kind of association between exposure and a disease outcome, and between establishing cause and effect relationship. لما نحكي cause and effect خلاص we established that. معناته this will cause this. أما لما نحكي risk factor we are talking about association. But we cannot assume that this risk factor will cause the outcome. Okay? You have to be clear about that. Okay. Let's talk about survey research. There are two main types of surveys. One is descriptive surveys. You are identifying psychosocial variables such attitudes, opinions, knowledge, and behavior. هذا بنحكي له إيش? What we call it descriptive. We are describing things. But there are another stronger type of survey اللي هو explanatory. We want to explain why this is happening مثلا, why those people have this attitude, or why those people have better knowledge than the other people. Okay, so you look at dependent variables such as behavior, knowledge, and you are trying to link it to independent variables such as age, sex, education. Okay, now there are four main sources of errors في surveys, okay, which you need to be aware of. Okay, إذا we have four sources of error. The first one is referred to as coverage error. Okay, وشو معنات coverage error? إنه the target population, that population which I need to target, I need to go for, is different from which I took my sample. Okay, for example, let's say I want to look at the opinion of elderly about something. Okay, and then I go to the mall and I start to find who are the elderly there. For example, I'm just giving you an example. But you know, maybe elderly, they do not like to go to malls. So many of them, they prefer to stay home, maybe because they cannot walk, or they have disease conditions that prevent them from going to malls, etc. So what I mean, that you are going to places, okay, which you want to take a sample from those places, but they do not represent where the target population is. They call it coverage error, and the other name for it, sampling bias. Sampling bias. Okay? طيب, sampling error is also referred as random error. Okay, بدنا ننتبه. Sampling error, this is the second type of errors, is also referred to as random error. And let me tell you what does it mean. Let's say that, okay, you went to the right place or to the right places where your population is there where you want to sample, okay? And you did everything to have your sample in the right way, but you know, there is always chance that your sample does not represent the population or the target. It is possible by chance. It's you don't have control over it. Okay, that's chance. When you take, for example, let's say I want to take from your class 10 students to represent the class. Okay, to represent them in what sense? To represent them scores. Okay, but maybe by chance I took the best 10 or the lowest 10 person or lowest 10 scores. This is possible, but it's not under my control here. So that's why they call it random error or sampling error. And usually to decrease it, you need to increase your sample size. Okay? And usually they report sample error by mean plus minus 1 standard error, SEM. Standard error from the mean. طيب, there is another type of error, third one, اللي هو measurement error. Okay, everything is good. I don't have sampling error. I have good coverage, etc. But maybe the person who's involved in collecting the data from the participants, maybe the presence of interviewer will influence the answers. يعني, for example, let's say Tala or Tulin, she wants to do interview. So she goes to the mall and then she talks to people. So the first participant comes, he say, okay, I would like to participate. Then she will ask the participant, do you smoke? She now, Tala or Tulin, she believes that everyone smokes, or she wants to show that there are so many people smoking. Okay, so the person will answer, no, I don't smoke. Are you sure? She will tell him, are you sure? Because she's in herself, she wants to believe that everyone, that's what she believes in, that everyone is a smoker. So he will say, no, I don't smoke. Not even vape, not even shisha or argile. So okay, if the opposite was true, if she wants to look or to prove that none of the people who go to the mall they smoke, she will start emphasizing the other way. So if the person say, yes, I smoke, yeah, but maybe you are not a frequent smoker, so I will put you no. فإذا the interviewer can cause bias. بنحكي لها response bias. Okay, but this time, sometimes it's not because of interviewer, it's because, and this is actually just to let you know, I have found that many students, they do not write the questionnaires in a well written way. Okay, sometimes the questionnaire is not clear. Okay, it's unclear, and this will cause the responder either to answer incorrectly, not to pick the right answer, or even leave the question because he or she does not understand the question. So this is very important thing that you should be aware of. Another thing is non-response error. For example, Tolene, she will stand in the mall and then someone will come and she will approach someone and she will ask him, can you please participate in our survey? He will say no, for example. Now, Tolene, she has to report that okay, there is one person said no. Second person, she approached second person and he said no. She should report that. Now I have two who said no, and so on. So if she finds, for example, that 70% of people, they do not want to participate in survey and only 30% participated, that causes what we call non-response bias. Which means that if those who said no, they don't want to participate, what can happen if they participated? They may change the data significantly. Okay, so when you have large percentage of non-responders, okay, you will have problem in your data. Okay, that's why when you whenever you want to do because I know that many of you do survey studies, so you need to make sure that you use a way to ensure that almost most of the people you approach will respond. So you might need to call them, you might need to provide them with incentive, the questionnaire needs to be short, etc., in order to encourage them to participate. So what we call this type of error, non-response error or non-response bias. Okay, the fifth type of observational study اللي هو case study, case reports, case series. Now case study also it's referred as a case report, is referring to a single patient, the number of one, as I said. But when we say case series, we are referring to a group of patients. It has, as I said previously, it has no control, no comparison group. They are just simply reports on what happened to patient or group of patients when they were under treatment. Okay, now it doesn't mean that case studies or series they are not useful. No, they are useful in identifying maybe rare adverse effect. They are useful, so the physician will know that this is a rare adverse effect. It's not in the label, drug labeling. It has happened before, and this is what has happened. Okay. Also, case studies or case series can generate hypotheses. Yani I can benefit from them to do a controlled clinical trial based on case studies. Post-marketing surveillance studies. Okay, you will find that I didn't put number 6 here because it can be observational or it can be just like normal controlled clinical trial. They refer to it post-marketing surveillance, yani it's done after the marketing of the drug, after the drug got the approval and started marketing it. Usually the FDA and the company itself, they want to know what will happen when this drug goes to the population and there are large number of patients who will take the drug compared to phase 1, phase 2, phase 3 studies. In phase 1, 2, 3, altogether maybe there will be 5,000 patients involved. Okay, but post-marketing there will be hundreds of thousands, if not millions of people who will be taking the drug, which will mean that rare adverse effects that have not been shown or demonstrated in the clinical studies phase 1 or 2 or 3, maybe they will appear in the post-marketing surveillance. Also, maybe the adverse effect appears in clinical phases, but they are not accurately determined because they are rare. Okay, so now in post-marketing they can be accurately determined. The most important thing for post-marketing surveillance is identifying potentially side effects. Okay, and let me tell you, post-marketing surveillance studies, they are also referred as phase 5 studies and also referred as pharmacoepidemiologic studies. Okay, and they can be, or the main job is to, as I told you, is to identify maybe and determine the rate of adverse effects accurately, maybe to identify new adverse effects. These are the main things. And why I didn't put it as observational, it because it can be cross-sectional, case controlled, cohort. هذا كله observational, صح? But it can be even experimental designs, يعني randomized controlled clinical trials. That's why I didn't include it as number 6. If a new adverse events is reported, then this might require to change the product labeling, okay, to reflect the new events or events with increasing frequency. Here you will see how they, طبعا after we completed the studies, now you should know how you rank the study with regard to its power for evidence. يعني when I want to provide evidence, which one is strongest? Is it the case study? Is it the cross-sectional study? Is it the case control? Is it the controlled clinical trial? Just one thing I want to tell you, which is negative regarding cross-sectional study. You know, if I give you a hard exam, and most of you get bad mark, okay? And directly after that, I do a survey with you regarding whether you benefited from the course or not, okay? Most probably you will start giving low scores because I surveyed you directly after the exam, okay? برضو if you go to you are traveling from Ajman to Abu Dhabi, and you know that on the road there are radars, okay? So when you see a radar, when you approach this radar, what do? You slow the speed of the car, okay? معناته the cross-sectional study, the most important negative thing, it doesn't have a follow-up. It's just at one point, which might not reflect what is happening during a longer period of time, okay? But let's go back to the power of study. You studied about whether there is a controlled or uncontrolled trials, okay? Let's say I done a clinical trial, but it's not controlled. Which one is which one is stronger? طبعا when you have a control, it will be more useful and it can help you in making a better decision. طب interventional versus observational study. طبعا الانterventional trial can show cause and effect relationship. أما الobservation شو حكينا? Indicate correlation or association. It doesn't tell you that this will cause this. Okay? طيب power, no power. طبعا لما احكي powered, I mean here there is the right number of subjects. Not powered, يعني either the power of the study اللي هو it must be 80%. If you remember back في previous chapter, controlled clinical trials evaluation, the study power should be at least 80%. How you can increase it? By increasing the number of participants. It's the power to detect a difference. So if it is not calculated, or if it is calculated but the participants are less than the calculated number, then you might not have detected a difference if it existed. Okay? طب prospective versus retrospective, يعني cohort versus مثلا Torah or case control. Prospective cohort design allows for better elimination and control of extraneous variable. عشان هيك results بتكون more reliable. يعني if I look in the history, I might be missing something. But if I follow up with the patients to the future, I keep following them, I will be able to control better variables that can affect the results. According to that, the strongest is the interventional powered who controlled, interventional no power, بعدين observational prospective اللي هو الكوهورت، observational retrospective، بعدين ايش الانكنترول زي الكيس سيريز واللي هي uncontrolled وكمان retrospective. I want you to memorize this pyramid. Okay, if you look at this pyramid, it will show you the weakest evidence to the strongest evidence. See, the weakest ones اللي هو preclinical research اللي هي first the one that is done in vitro يعني بالبيكر وبالجلاسز إلى آخره. Then stronger than that is the one that is done on animals. هذا بنحكي له preclinical in vitro في الجلاسز وبالانيمالز. طيب after that you have the clinical evidence that may be provided by editorials and commentaries comments يعني. Then stronger than this is the case report case series. Stronger than this is the case control. Stronger than this is the cohort studies اللي هي prospective. cohort يعني معناها group. Then stronger than this اللي هو randomized controlled trials. طبعا you should rely, if you rely only on one, that is weak. If you rely on more than one, then that is really strong. Then the strongest اللي هو systematic reviews and meta-analysis. Okay? طبعا only if it is done in the right way, then these can be stronger. لأنه انتبهوا الميتا analysis و systematic reviews, they take more than one randomized controlled clinical trial together. Okay, they look at more than one clinical trial in order to make a decision. So let's talk a little bit about the review articles. There are three types of review articles. في عنا ثلاث أنواع. Okay? One اللي هو non-systematic, and we call it narrative reviews. narrative يعني يقص علينا موضوع معين. Okay? Non-systematic. The other one is the systematic reviews. And systematic reviews can be qualitative or quantitative. The quantitative, sometimes they refer to them as meta-analysis, or actually most of the time it is referred to as meta-analysis rather than a systematic review. But it is a systematic review. So these reviews are becoming more common in order to keep readers up to date with the information that keeps pouring into literature or in the literature. For the narrative or non-systematic reviews, they do not apply a system, a way, an order by which the search is done and how it has been combined together, etc. And usually they try to address broad, يعني واسع, broad rather than focused clinical question. Okay? Usually the authors are expert in the field and they know the conclusion and they have good knowledge about the field, so they want to write about it. Now these reviews have been largely replaced by systematic reviews, such as the qualitative or quantitative reviews. Now, بالqualitative and quantitative, there is a formal criteria for trial selection. في عندهم how do they select trials, what should be, for example, the period of publication, the language, what should be the method. This is very, very important. Is an method that they use should be what does it has to contain. And when I say the method, here I mean who are the population, what is the intervention في المethod they used, what is the control they used, and what is the outcome they measure. Now these are very important things in determining which trial publication to use. Okay? On the quantitative systematic reviews, usually the conclusion is based on the data reviewed. يعني initially the reviewer does not know what will be the conclusion. Unlike the narrative is someone expert who knows what is the conclusion already. Okay? The difference actually between a qualitative and quantitative systematic reviews, the difference is that in meta-analysis or quantitative reviews, they combine the results from the clinical trial. They put them together in a pool. يعني whatever their data في clinical trials they collected, they put it together as one big clinical trial. Okay? بينما في qualitative, no, they don't put the data together, but they critique and they evaluate the data of clinical trials individually rather than put them together. طبعا systematic reviews, whether quantitative or qualitative, they provide good evidence for the practice. As I told you, narrative lacks description of systematic methods, يعني depending on what they are going to include the literature they get from their search, depending on what they don't say. Okay, بينما and that's why narrative reviews, they are more like textbooks, chapters in the textbooks, and that's why in many cases they are considered as tertiary literature. And if you remember, I told you, if it is narrative or non-systematic, we are going to consider it as tertiary, even though sometimes they consider it as secondary. Okay, the systematic reviews are considered as secondary, بينما non-systematic or narrative reviews are considered as tertiary resources. Regarding the systematic reviews, I said, or I told you that in the qualitative systematic reviews, the results are not statistically combined. For the quantitative reviews, they are put together and then analyzed. They are very useful meta when the clinical trials that are published, they have contradicting results, or the sample size in them is small. In this case, بيجي meta-analysis and it will make them stronger by combining the results together. In this table, you will see the difference between non-systematic and the systematic reviews, whether qualitative or quantitative. See, the clinical question, what are you surveying, or what are you reviewing? Usually for non-systematic, as I said, it's broad, بينما في systematic it's focused, يعني very specific. In literature search, the method is not described. ما بحكي لكم وين فتش how, depending on what, it doesn't say. But في systematic they say that. Studies included, they don't say how they included the studies. يعني there is kind of bias here because it depends on the author. بينما في systematic it's predefined what to include prior to the starting of reviewing the articles. They tell you how they're going, which ones they will include, depending on what are the inclusion and exclusion criteria for the articles in their study. Are they going to include unpublished literature? And here they considered as gray literature. The gray literature, the ones that are unpublished, maybe it's available في الفactory but they did not publish it. For non-systematic, usually they do not include that, but for systematic it's possible that they will include it. طيب هل في هناك blinding of reviewers? What does it mean, blinding of reviewers? يعني let's suppose Tala, Tolin and Zahra, they are going to do a review, systematic review, okay? So they put their inclusion or exclusion criteria. And they done their search and they found, let's say, 100 articles. لقوا 100 articles. The first thing for them to say, okay, are we going to include what we are going to include now? The first thing is for them, شوف انتبهوا, this is very important, is to keep someone or let's say Zahra will keep Tolin and Tala blinded. يعني they don't know, لما احكي blinded here, they don't know the results, they don't know the authors, they don't know from which university, okay? And Zahra will give them the method in each paper, only the method. She will give Tala and Tolin the method of each paper, and then she will tell them, depending on the method, refer to our inclusion and exclusion criteria and tell us whether we need to use this paper or not. Okay? طبعا Tolin وتالا, they don't know the results, they don't know if it agrees with them or not, they don't know nothing. After Tala and Tolin they review the method, they say, okay, from these 100, these 50 fits our inclusion exclusion criteria. So, but they don't know what are those papers, who are the authors, what are the results, they don't know. فبيحكوا لها ايش؟ blinding. Okay? طبعا after that they will need now to read the whole article, اللي هم ال 50 articles, they will need to read them complete, okay, before they can proceed further. طيب, analysis of data for non-systematic it's usually variable and subjective, بينما for systematic qualitative it's rigorous and objective. يعني they analyze things rigorously, critically, objectively. هل results statistically evaluated, يعني they are put together وبعدين they are analyzed. في ال non-systematic no. في ال qualitative they don't put the results together and then they do the analysis. بينما بال quantitative they do that. Okay? Usually in order, as I told you, to find or to do a search, you need to follow Pico. Pico is abbreviation for, okay, يعني for example, let's say Tala, Zahra, Tolin, Hamas, Hana, Zubayda, they want to do a research, a review. First, they have to determine the question, and from the question, they need to determine Pico. So what is the question? What is this Pico? Okay? What is this clinical question for which they will need to determine Pico? Pico is what target, what population I'm talking about, what patients I'm talking about. For example, diabetic patients, cancer patients, hypertensive patients, they need to talk about that. Then Another thing they need to determine which intervention, which drug treatment should be provided to those patients. So what is the intervention? Third is, it's compared to what? This treatment is compared to what? To placebo or to maybe another drug. Okay, so they need to determine that. And fourth, they need to determine what outcome they are looking for. Is it cholesterol level? Is it morbidity, cardiovascular problem? Is it death? What is it exactly they are looking at? Okay, so their focused clinical question should determine Pico. يعني from the question they should determine Pico اللي هو ال patients intervention والcontrol والoutcome. And when they want to start and do the literature research or searching for the article, they should follow PRISMA guidelines or PRISMA statements. اللي هي, what is PRISMA stands for? Preferred reporting items for systematic reviews and meta-analysis. So what they should do exactly, now this diagram summarizes what you should do. First of all, you should use more than one database. Don't just use PubMed. Don't just use only Google Scholar. So use more than one database. For example, PubMed, Embase, or PubMed, Google Scholar, and maybe even Scopus. Okay, so use more than one database. And do the search according to the Pico. Remember here what we talked about. Do the search. So from each database you will get n results. From Google Scholar you get something. من PubMed you get another number. There is high possibility that there is duplication. يعني some of the data you get you get from this database is the same as this one. طبعا when you put them في اللي هو Mendeley, when you take them to Mendeley, there is a way in Mendeley for you to actually find the duplication. If you go here, you see here, check for duplicates, and it will provide you if there are duplicates, and you need to remove these duplicates. So when you remove these duplicates, you will end up with a number from these two resources after removing the duplicates. طيب, now you will do the screening. هنا البلايندنج اللي راح يصير, and you will only look at the method في الابstract, what method they used. Okay, so according to method you are blinded. According to the methods you are going to remove some or exclude some articles because it doesn't meet inclusion or exclusion criteria. So you will end up with certain number of articles. Now you need to read the full articles, read them complete, to see whether they are eligible or not. هلا, if you remove something, يعني a full text article excluded, if you remove some articles, because you need to state the reasons why, the main reasons why you removed. For example, from the 50 articles you removed 10. Why? So now you have 40. So the studies included in the qualitative or quantitative studies 40, not 50. So why you remove these articles even though they passed or they were allowed to enter? يعني المethod used was okay. So why after reading the full article you decided to remove some? So you need to state these reasons. Okay, this is how you do systematic reviews. Now, reviews are described as retrospective because you are looking at published data that already were there, whether it's published or not published. Not published, as I told you, اللي هي can be in the manufacturer, maybe you get it from another investigator, etc. But of course, there is controversion regarding the inclusion of something that is not published. What they say is that these literature can affect the results and they have not been peer reviewed. You don't know whether these data are accurate. So في controversion عليها. But why you need to include it? Because the problem is the data published with positive results are more than negative. Okay, that's why maybe you need to look for unpublished data. So if you only review articles that are published, most probably it will be positive, and there is a kind of publication bias. Okay, a publication bias. So it's good to include unpublished data that might contain some negative results. But again, as I told you, it's not peer reviewed. You don't know or there is no confidence on them. You don't know whether it's done according to the right methodology or not. I think I've talked about most of these things, but the important thing regarding the quantitative or meta-analysis reviews, that they provide supporting evidence for clinical decision making. This is very important. It provides a quantitative and objective assessment, gives greater insight into clinical trials, because now you are putting more than one clinical trial together. Especially, I'm talking here when the clinical trials, different clinical trials are inconclusive. They are not very clear to say yes or no, or they may be contradictory, or maybe the sample size is small. I already talked about all these things. Now, the problem, the main controversy about the quantitative analysis, or the main thing, is that, when they put the results of different clinical trials together, one, there is no assurance that these trials are homogeneous. يعني they were designed in the same way. Everything was tested in the same way. Follow-up was in the same way. So it's very difficult to make sure that these trials are homogeneous. Okay. And another thing is any bias in individual clinical trial. Let's say there are some biases for controlled clinical trials. When you put them together, you are combining these biases together, and you might end up with a new type of bias. Okay. Anyway, when you want to evaluate a review, you should evaluate whether there is clear definition of the clinical question. They provided details how they done research, and what are the criteria for including the studies and excluding them. The authors might go to textbooks and experts in the field. Okay, but as I said, for gray literature, it's controversial. I think I've already talked about most of these things. Financial support, you should look for every clinical trial. You should see whether there is financial support from the company that might influence the authors. طبعا it doesn't mean the presence of financial support, it doesn't mean انه في bias, no, but you might suspect that if the conclusion is strong positive conclusion, okay, even though it's inconclusive or weakly positive. By practice guidelines, there are three types of practice guidelines you need to be aware of. طبعا the clinical practice guidelines, they are important for in the hospitals, they are important also for the pharmacists, because they tell you how to deal with any situation, what you should first do, second, what are the steps. So if you follow these guidelines, it will give you some kind of legal protection. يعني if you don't follow the guidelines and something happens to the patient, they may tell you it's your fault. You shouldn't have started with that. صح? But if you follow the guidelines, especially if it is evidence-based guidelines, then you are kind of legally protected because you are following the evidence. Okay, and these guidelines sometimes they come from high authority, Ministry of Health or WHO, etc. So if you follow them, you are kind of protected legally if something happens to the patient. There are three different types of guidelines. First, evidence-based, or they call it explicit. The other two اللي هو formal consensus based, يعني it has been agreed by experts agreed about that. Formal, في عنا formal, في عنا informal consensus based. Let me just a little bit talk about formal and informal. They are useful when there is no clear evidence. The evidence is weak, يعني ما في هناك clear. In these cases, we rely on the opinion of experts to develop a guideline, a practice guideline. So this can be formal. Formal يعني structured. يعني for example, I contact the experts through maybe questionnaire. I send them a survey, structured survey, in order for them to answer it, and based on that I do the guideline. فإذا في هناك formal process. In this formal process بيكون في هناك predefined method, how I'm going to do it, based on what, how it should be analyzed, the answers from the surveys, and based on that they will develop the guideline. Informal معناته it's unstructured. يعني I didn't make a survey, I didn't put them I didn't have a pre-designed method to develop this guideline. يعني for example, let's say some experts they discussed with each other, okay, and maybe one of them based on the discussion he started writing the guideline. فبنحكي له it's informal consensus. هلا consensus معناها agreement, okay, based on the agreement between the experts. طبعا evidence based is the highest the strongest type of guidelines, then the formal, and then the informal. The strength of the guidelines actually comes from where it comes from, as I said. what is its type, where it comes from, how is the dissemination of the guidelines, يعني توزيع الguidelines. Maybe, for example, let's say WHO, they send UAE, Ministry of Health, they send the guideline, but the Ministry of Health do not send it to hospitals. Okay, so follow through to make sure that all these guidelines have been disseminated. Another thing اللي هي if experts have يعني in the hospitals have contributed to this guideline, they most probably will also follow the guideline. I'm talking طبعا here طبعا the most important factor اللي هو evidence. Other factors اللي هو intensity of dissemination, follow through of dissemination, type of problem addressed, source of guidelines. مثلا هل هي جاي من الهوسبيتال or it's from Ministry of Health or it's from WHO, etc. Physician participation in the development and adoption of the guideline. Legal consideration. If they tell you that if you don't follow this guideline, anything that happens to the patient, you'll be responsible for that. Also, financial and administrative issues will affect that. Okay, the last thing we want to talk about اللي هو health outcomes research. This is very important topic. It's kind of broad. It involves the discussion or the study of pharmacoeconomic, therapeutic, and non-therapeutic outcomes. Non-therapeutic outcomes اللي هي number of visits to emergency room or number of hospital admissions. So the study of these with quality of life outcomes. إذن لما أدرس هاي الشغلات with quality of life outcomes, then this is health outcomes research. But what do I mean by quality of life? It's a multidimensional concept and it talks about the impact of disease and treatment relative to well-being of patient. Well-being of patient. يعني how do you feel well? You know, if you are handicapped or if you are you cannot function, you cannot see, you cannot talk, or you cannot walk. Okay, this will affect your well-being, or if you are in a lot of pain. Now, the emotional and existential reactions, your emotional reactions to physical and social environment will affect quality of life. So how you are reacting emotionally with the physical and social environment around you. When we talk about specific thing, health related quality of life, we are talking about the value assigned to quality and quantity of life. شوفوا quality and quantity. Okay? And quality and quantity might not go together. يعني you might have good quality, bad quantity. يعني you might have few days to live, but you have good quality. Or you might have a bad quality life, okay, but they will allow you to live for longer time. Okay? طبعا these values are not direct. You cannot assign them directly. Okay? طبعا they will depend on patient's symptoms and how he feel about them. Okay? So direct measures of health-related quality of life is impossible. Only inferences from patient symptoms and reported perceptions. طبعا here I just introduce you to what do we mean by health outcomes research, because this is becoming a more important study in the pharmacy, and you might encounter it. So I thought, well, you need to learn about such study. إذن health outcomes research, these are research that can be related to pharmacoeconomic, can be related to therapeutic or non-therapeutic outcomes. When they study such things in relation to quality of life outcomes. Quality of life outcomes here related to well-being of patients, how patients react and express themselves emotionally in relation to physical and social environment. Health-related quality of life, هنا we are talking about a measurement of quality and quantity of life, which is not direct. Okay, it is not direct. So how we get it? We get it from patient symptoms and how he perceive or how he report such symptoms. Okay. طبعا when we say quantity, طبعا we know the quantity, how much the person will live for. Quality can be طبعا quantity can be modified by impairments. Okay, maybe you cannot walk. Okay, or your hands keep shivering, so you cannot hold things. Functional state, can you function normally or not? Perception, social opportunities, these are related to quality and quantity of life. Okay. Okay, I hope you benefited from this today's topic. Of course, if you have any question, you can always ask me through WhatsApp, through email, during the classes. I'll be very happy to answer you. Okay, have a nice day. Take care. Bye-bye.